speaker is Dr. TREEZA B. Joseph. Her topic is ocular manifestations in patients with psoriasis attending a tertiary healthcare center. Over to you.
Good morning. My paper is on ocular manifestations in patients with psoriasis attending a tertiary healthcare center. Introducing the topic, psoriasis is a systemic condition affecting 1 to 3% of the world's population. It's a chronic inflammatory disease affecting the skin. It's an immunocellular dysfunction and inflammation, and it manifests as erythematous and squamous plaques. Ocular manifestations in psoriasis may be due to direct or indirect mechanisms. Direct mechanisms include eye involvement with psoriatic plaques, and indirect mechanism involves immune-mediated inflammatory response. Aim and objective: early detection of ocular manifestations observed in patients with newly diagnosed psoriasis, and to detect and report any changes in the retina using OCT. Materials and methods. Study design: it was a cross-sectional study. Study setting: in the Department of Ophthalmology and Dermatology in the Tertiary Healthcare Center. Sample size included 50 patients with newly diagnosed psoriasis. Those patients who had signed and informed consent and those obtaining high quality OCT images, that is signal strength more than 6 out of 10, were included in the study. And those patients with history of ocular trauma, ocular surgery, and with Stevens-Johnson syndrome were excluded from the study. Method of data collection: 50 patients with newly diagnosed psoriasis were selected. Detailed history and examination were done, and OCT macula and RNFL were recorded. Coming to results, out of the study sample, 54% were males and 46% were females. Visual impairment was found in 32% of the patients, and the rest retained normal vision. The ocular manifestations found were dry eye, keratoconjunctivitis, blepharitis, uveitis, episcleritis, and cataract. The corresponding percentages of these manifestations were: dry eye was found in 40%, keratoconjunctivitis in 30%, blepharitis in 14%, uveitis in 12%, episcleritis in 8%, and cataract in 20%. The mean IOP among the study sample was 14.26 mm mercury. Mean photostress recovery time was 19.15 seconds. Mean RNFL thickness was 92.54 microns, and mean central macula thickness was 258.90 microns, which were all within normal limits. Coming to discussion. Psoriasis, being an immune-mediated disorder, affects the lacrimal and meibomian glands, and therefore causing dry eye, which is the most common ocular finding. Normal eyelid flora is disrupted in psoriasis, leading to an overgrowth of ocular staphylococcal species, leading to blepharitis. Pro-inflammatory cytokines like TNF-alpha and IL-6 are increased in psoriasis, leading to increased oxidative stress, thus leading to secondary cataract formation. Coming to some previous studies, Carlia et al. In the study Ocular Manifestations in Moderate to Severe Psoriasis in India, a prospective observational study conducted in 2022, concluded that most common ocular pathologies observed in the study were anterior blepharitis and moderate dry eye. Cosby et al. In the study Psoriasis and Uveitis, conducted in 2022, concluded that relation between non-arthritic psoriasis and uveitis have not yet been fully elucidated, and that physicians who treat this disease must be cautious and refer their patients to an ophthalmologist even if they do not have any ocular symptoms. Concluding, psoriasis have several ocular manifestations even at the start of the disease, many of which leads to visual impairment as well, such as uveitis, keratitis, and cataract. Most of these are curable, and further complications like corneal ulceration due to severe dry eye can be prevented by timely detection and treatment. Hence, patients with psoriasis should undergo regular eye examination regardless of risk factor to monitor for progression of ocular manifestations. These are the references. Thank you.
So you have shown the pictures, because iritis or something. Is it Indian picture or something different, feminist?
Sir, iritis
it-
was not there, blepharitis was there.
Blepharitis was,
Yes, sir.
but you have shown some iris picture, that is something appears to be a, not
No,
belong to
sir,
the
it's an Indian picture.
Indian picture. Your
sir.
patient's picture.
Yes, sir.
Sure.
Yes, sir. Yes, sir.
Okay. Because when you present, no, you must have all our own pictures only. Have you done any HLA relations? No.
Excuse me, sir?
HLA association with HLA.
No, sir.
You have not done. Okay, thank you.
Thank you.